Microinvasive glaucoma surgery, otherwise known as MIGS, are a group of procedures that we offer patients who are undergoing cataract surgery and have concomitant glaucoma. These procedures are categorized by their minimally invasive nature, as well as the ability to perform them at the same time as cataract surgery. They are much less invasive than more traditional glaucoma surgical procedures and a great option for patients who are undergoing cataract surgery.
I think the value of offering MIGS at the time of cataract surgery can't really be overstated. A lot of patients with glaucoma, one of the hardest things about being adherent to the medication regimen is just the constant drops going in the eye, a reminder every day of sort of the morbidity that they have associated with their eyes, the cost of the drops, the toxicity of the drops. We know almost every single glaucoma drop out there can cause either ocular surface irritation, periorbitopathy, CME. There's just so many side effects. And so if we are already in the eye at the time of cataract surgery, to be able to do a MIGS procedure and potentially get the patient off 1 or 2 or even 3 glaucoma drops, I think that can lead to a massive quality of life improvement, putting aside even just the benefit of treating their glaucoma. We know that the act of cataract surgery alone will drop the pressure by 1 or 2 points permanently, but if we're already in the eye and we can do something like place a shunt or do canaloplasty or some other sort of procedure, I think there's a lot of value-added benefit there.
We also know that compliance is a big issue for glaucoma patients, and use of eye drops, for many of the reasons you mentioned, is not really preferred by patients. And there may be compliance issues that leads to progressive glaucoma, yet another indication to consider this as an additive option for patients or an added benefit at the time of cataract surgery. The different options that we offer our patients really fall into 2 main categories. These 2 categories include implantation of tiny stents or creating dilation of the natural outflow of the aqueous of the eye. In both procedures, the goal is to lower the intraocular pressure and improve the control of the patient's glaucoma. The choice of which approach we take really depends on the severity of the patient's glaucoma, as well as the number of drops that they are on and how many we hope to get them off of. We don't need to get into the details of the different options. Really, we make that decision when we are seeing the patient. But it's important to plan the seed ahead of time. If you have a patient who has cataracts, you are referring in for cataract surgery, they also have glaucoma, they are on at least 1 eye drop for glaucoma control, I think it's important for them to understand that there will be an option potentially available to them to help them lessen the dependency on their glaucoma drops.
Yeah, and I think that's a really important point. In the United States, in order for MIGS to be covered by insurance, certain criteria must be met. So obviously the patient needs to have mild, moderate, or advanced glaucoma, but there also needs to be demonstration that they've at least been tried on 1 IOP topical drop and that they've failed that therapy. And so if you have a patient with glaucoma and they get sent over for cataract surgery, we can't necessarily do MIGS just because we think they have glaucoma. And so that's where the workup in the preoperative setting is really important. So if you're able to get a patient a visual field, if you're able to get an OCT-RNFL, you're able to trial them on some IOP lowering drop, that can all be very beneficial, because then when they see us for the cataract consultation, we don't need to send them back or do any extra workup. We know we can already confidently put together a plan that involves cataract surgery as well as MIGS at the same time. And so that's where the collaboration, we really value that with you, because we don't necessarily have some of the glaucoma testing available for us here. And if you're able to get that on the front end, that makes the process nice and smooth.